Greetings, ladies and gentlemen. This is your friend and brother, Doctor. I welcome you all back to my channel. If this is your first time of joining us, I will highly welcome you in a special way. This is a YouTube channel where we promote health in the language that you can understand, devoid of medical jargon. If you are a returning subscriber, I highly appreciate your patronage. Today, we shall be talking about infection. The reason is because of the experience I had in the clinic today. A young lady came and said she has infection and she has been treating it. It has been, she will treat it, it will go and come back again. She will treat it and it will go and come back again. Well, actually, what she was referring to was sexually transmitted infection, which is a subset of the word infection. So I just want to, do a little video so that you run with the accurate knowledge. Okay, so what is an infection? Okay, it can be simply defined as when microorganisms invade your body and start causing you problems. All right, and microorganisms are what? They are organisms that cannot be seen with the naked eyes except with the use of microscope. Example is bacteria, virus, and fungi. Okay, these are microorganisms that can infect you. So you can have a bacterial infection, you can have a fungal infection, you can also have a viral infection. Okay, and all these things have their own modalities of treatment. They are not the same. So you cannot be using the drug to treat viruses to be treating bacteria or for fungi and vice versa. All right. Also, infections can also be classified based on the part of the body that was affected. So you can have infection of the hair, infection of the eyes, of the nose, of the lips, of the tongue, of the teeth, of the every part, including your nails, toenails, fingernails, can get infected. Okay, and they all have their different names. So it is not right to say I have infection. We have not said anything. It's just like saying that my car has a problem. Have you communicated? Absolutely no. Because what you need to do is what happened to your car? Is it the tire? Is it the steering? Is it the glasses? Is it the engine? Is it the seat? What exactly happened? And even if it is the tire, what happened to the tire? Is it nail puncture or it busted? So when you say I have infection, it is you have not communicated. All right. Another thing is this: there is nothing like toilet infection. There is nothing like toilet infection. So when you go and people tell you that you have toilet infection and you need to treat it and they collect your money, you are just simply wasting your money. Okay. When you have today, what most people regard as infection generally is sexually transmitted infection and urinary tract infection. Many people don't know the difference and they don't know the treatment. And that is why somebody came and said, Doctor, I need drugs. I said, drugs for what? She said, for infection, that she went to lab and she was told that she has infection. I said, what infection were you told that you have? She said, staphylococcus. All right. You see, that's a story for another day. I'm going to make a video about this phenomenon of this staphylococcus that we hear in almost every market today. So, sexually transmitted infection can also be bacterial. It can be viral. It can be fungal, and they have their own modalities of treatment. Urinary tract infection can be bacterial, can be fungal. So, all these things cannot be muggled together into infection. So what is the import of the message? When you think you have a problem, when you think you are sick, please go and see your doctor. I cannot see the reason why, if your phone develops a problem, have you ever tried buying a spanner to lose the phone and try if you can do something by yourself before going to the phone repairer? No. If your car develops a problem, you go to a mechanic, right? If you want to repair your clothes, you go to a tailor, right? Then how come when you have headache or you have fever or you have something, you go and start guessing which drug will you buy, which drug will you not buy? And when you must have bought like 2, 3, 4 different kinds of medications and it didn't work, you eventually present to the hospital. By that time, the doctor will not know what to treat, whether it is the problem you had initially, or the complication of the problem, or the complication of the drugs that you have taken. Some people have done this mistake and paid with their lives. Some people come and they spend times 10 of what they ought to have spent if they had presented initially. So, knowledge is power, according to Francis Bacon, and according to the Holy Bible, my people perish because of lack of knowledge. From my experience, information is more powerful than medications, and that is why I am bringing this information to you. You will do yourself a lot of good. You will do yourself a lot of benefit. Even if it's just slight headache, just go to a doctor and complain all your symptoms. If you are not satisfied with that doctor, you go to another one. All right, because that's what most people complain. If you think that the doctor you are going to is not satisfying you, find another one. It will do you a lot of good. I'll give you an analogy. Headache is not a problem. It's not a disease. All right, it is a symptom of a disease. In other words, it's an outward sign of an inward problem. For example, you open your window and you start perceiving some abnormal odor. Probably somebody defecated behind your window. Okay? And if you close your window back, the odor diminishes. That closing of your window is like taking paracetamol when you have headache. Okay? If you close the window, you won't perceive the odor again. If you open the window, the odor comes. In other words, closing the window is not the definitive solution to the problem, but rather finding a way to evacuating that physics that is, producing that odor. Then the same way it happens when you have headache or anything. You take paracetamol, it goes. After 2, 3 days, it comes back again. You take another paracetamol, it goes. You see, that paracetamol is just, you are treating, we call it symptomatic treatment. You are not helping yourself because you are just masking the outward sign that should have shown us the inward problem when it was at the early stage. So if you present to hospital at that early stage, it will be very easy to the doctor to pick it up and treat you straight away with the right medication and you are fine. Some people, their own is they will go to lab, do all sorts of tests, and then come and say, doctor, I have done this test, come and prescribe drug for me. I will also do a video on that concerning, test. But today, I want to concentrate on the phenomenon of infection. And I believe I have done justice to that. You can have bacterial, viral, or fungal infection. You can have infection on any part of the body. It can be any system too. It can be digestive system, respiratory system, genital tract system, urinary tract system, and it could be viral, bacterial or fungal in each of these systems. So it is a complicated issue that you don't just mumble together and say, I have infection, I am treating infection. You are not treating anything. You are just harming yourself. I'm coming directly from the field, and everything I say here is based on what I have seen personally, and that is why I'm bringing it, so that you learn from the mistake of others, please. When you have a problem, go to a doctor and let the problem be solved straight away. Trying to self-medicate, eventually, most times, in most of the cases, you're just prolonging the problem, accumulating the amount of money you spend, and also accumulating the possible consequences. I believe a word is usually enough for anybody that is wise. Thank you so much for listening. My name is O Doctor. I appreciate it. Remember to share this video, subscribe, and inform your friends about this channel. Thank you. Bye bye. See you tomorrow in my next video.